Angie Riddle, Director of the Sleep Disorder Center at Harbin Clinic. Here at the Harbin Clinic Sleep Disorder Center, we have 4 beds and we are accredited by the American Academy of Sleep Medicine. Polysomnography refers to the study of sleep, and there are many sleep disorders. When people think of polysomnography or sleep studies, they often just think of sleep apnea. However, there are thousands of sleep disorders out there. Some of the symptoms will overlap between the different disorders, and it's important to get tested and to find out what's really going on while you're asleep. Some of the most common symptoms for sleep apnea are snoring, tiredness, irritability during the day, waking up with a headache in the morning, difficulty concentrating, falling asleep while driving or while at work. Some of the other disorders include insomnia, which may be a symptom or a diagnosis of its own, and narcolepsy. Narcolepsy is characterized by falling asleep at inappropriate times, such as while talking or any sudden emotion, whether it's laughter or being upset. This is one of our patient bedrooms. These are the wires we put on the patient when monitoring them for a polysomnography or a sleep study. These electrodes go on the head. They tell us if the patient's awake, asleep, or what stage of sleep they're in. We prepare the side on the head and then we glue these on with some paste and a piece of gauze placed over that to hold them in place during the night. We have an airflow sensor which goes just below the nose and above the mouth to measure airflow. It lets us know if the patient's actually moving any air when they're breathing. A band goes around the chest and another band around the abdomen. These measure patients' breathing effort. This lets us know if they're trying to breathe so we can distinguish central sleep apnea from obstructive sleep apnea. We also have a pulse oximeter probe which goes on the patient's finger, and it measures the oxygen level and lets us know what the oxygenation is during the night. There's a snore microphone. We tape this to the patient's neck and this measures vibration of snores during the night as well. Today we have Mrs. Hernandez coming in. She's already been tested for sleep disorders and was found to have sleep apnea, so today we're going to fit her for her CPAP mask and see how well she tolerates it. If you're interested in becoming a polysomnographic technologist, it's very important that you have good communication and interpersonal skills. The patient may be very nervous when they come in. They're not always comfortable sleeping in an unusual environment, especially with a lot of wires attached to them. And then when they know that someone's watching them sleep, it sometimes makes it a little more difficult. So it's important that you make them feel very comfortable before putting them to bed, and also have the ability to make them feel comfortable if CPAP or other treatment options are needed. You have a nasal pillows mask, which is like this, and the pillows simply go right in the edge of your nose. There's several brands of this, and then there's also a nasal mask. This covers just your nose, and you breathe in and out through your nose and it keeps your airway open. However, if you breathe through your mouth during the night, we'll either have to add a chin strap to help keep your mouth closed, or we'll have to use one of these masks that cover your nose and mouth. So what looks most comfortable to you to start with?
Probably that one looks like.
Okay, we'll try this, and then we'll try on a couple others as well. Okay, come this way and we'll get started. You'll have a seat in this chair. We have several wires to put on you tonight, but none of this procedure is painful at all. The first thing we're going to do is measure your head. I'll be making some little marks on there with a crayon, but they'll wash off in the morning. In addition to your interpersonal skills and good communication, it's important to be detail-oriented and to be able to focus on the little things that come up. Math becomes important because when you're setting the patient up, you have to measure the patient's head to apply the electrodes, and it's very important that you do this appropriately and are detail-oriented enough that you're going to have them in the same place on every patient, and if the patient comes back for a repeat study, you can be sure that the electrodes will be in the same place then as well. The people performing the sleep studies at Harbin Clinic are polysomnographic technicians or polysomnographic technologists. A technologist is a certified or registered polysomnographic technician. There are several ways to get into this field. I would first recommend doing well in math and science while in high school and preparing for a healthcare career. Once you're out of high school, there are several ways to become a polysomnographic technologist. To obtain certification, you can do this by having 3 months of paid experience and taking an A-STEP program. An A-STEP program is an educational program provided by the American Academy of Sleep Medicine. Another way of doing this is to become registered in polysomnography. You can do this by taking an A-STEP program and having 6 to 9 months experience in the field and then sitting for your registry. However, if you already have a healthcare degree, whether it's nursing, respiratory therapy, EEG, or others, you can go directly and sit for your registry exam. Another way of becoming a registered technologist is to graduate from a KHEP approved program. This is a healthcare program provided by one of your local colleges that provides a polysomnographic course. The polysomnographic technician position is a position in which you're not certified or registered. Some facilities will allow you to do on-the-job training and serve in this role. I would, however, encourage you to pursue your certification or registry. If you do take the certification, it is valid for 3 years, in which time you must take the registry exam or your certification will expire. Once you're registered or certified, continuing education credits are required to maintain this credential. The registry credential requires you to obtain 50 CEUs in a 5-year period. They don't have to be 10 CEUs per year, but it is recommended. As I mentioned, there are a lot of pathways that lead into polysomnography. A lot of EEG techs or respiratory therapists become polysomnographic technicians. I personally started off by going to school for a Bachelor of Science in Respiratory Therapy, and once I started in respiratory therapy, I became very interested in sleep disorders. At that time, I was trained and obtained my registry credential, and I've been doing sleep disorders ever since. Once we have the patient connected with all of the wires, it's all fed into the computer in the technician room. Each of these lines means something about their sleep or their sleep patterns. Each screen is 30 seconds of time, so we have 800 to 1,000 screens or pages, also called epochs, at the end of the night. Once we review this, we're looking for what stage of sleep. These top channels tell us what stage of sleep the patient is in. We have an EKG and a heart rate channel. We also have leg movement channels, so if the patient has myoclonus or periodic leg movements. We have a snoring sensor that indicates any snoring sounds the patient makes, and we also have airflow, chest effort, and oxygen level. We go through each screen 30 seconds at a time when scoring the record and tell the computer what stage of sleep or if the patient's awake. We then compress the data to a 2-minute screen, and we draw events around any of the snoring, EKG irregularities, leg movements, or respiratory events. The computer then generates a report for the physician to interpret and diagnose the patient with the appropriate disorder. While the majority of sleep technicians or sleep technologists do work at night, that's not always the case. There are also positions available for scoring the sleep studies during the daytime. Scoring includes reviewing the studies and identifying the stages of sleep, any disorders that are going on, and it prints a report for the physician. There may also be opportunities with equipment companies. These companies may utilize sleep technicians for sales or for tech support. They also may send you in to do training and installations for other sleep centers around the country. If polysomnography sounds like a career that you may be interested in, you can consult the Georgia AHEC Health Careers Manual or visit one of these websites. Thanks for joining me today. Good night. Sweet dreams.